Hello everyone, in this video we are going to discuss about radial nerve. Radial nerve originates from posterior cord of brachial plexus from C5 to T1. The course is from the axilla to the humerus, spiral groove of humerus to the lateral elbow to the forearm. So here the radial nerve, it supplies in the arm, it supplies triceps anconeus, brachioradialis and extensor carpi radialis longus. This is the only muscle in the forearm which is supplied by the main branch of radial nerve. Then in the forearm, so this main radial nerve will be divided into two branches, posterior interosseous nerve and superficial radial nerve. Posterior interosseous nerve is a motor nerve and superficial radial nerve is a sensory nerve. Posterior interosseous nerve supplies extensor carpi radialis brevis, supinata, extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, abductor pollicis longus, extensor pollicis longus and brevis, extensor indicis. The superficial radial nerve, it supplies sensory supply to the lateral 3.5 fingers, sparing the fingertips. Fingertips are not supplied by the radial nerve. So the sensory supply is posterior cutaneous nerve arm, posterior cutaneous nerve forearm and superficial radial nerve. So coming to the clinical relevance, whenever there is an injury at the axilla, so whole of the radial nerve will be damaged. So muscles affected will be all the arm muscles like triceps, brachioradialis, and there will be sensory loss of posterior part of arm, forearm and dorsum of the hand. There will be wrist drop and loss of elbow extension because all the extensor muscles are damaged. All the extensor muscles are deprived of the nerve supply. Next, after the injury at the mid-arm, that is spiral groove, then that is at the humeral shaft. Here, since already the triceps have already received the nerve supply, it is paired. All the other muscles like brachioradialis and the extensors of finger and wrist are damaged and sensory loss is same. There will be wrist drop but intact elbow extension will be there. Next is posterior interosseous nerve injury, that is a pure injury at the elbow. Here there will be it is the cause of the injury is radial head dislocation or fracture. The finger and wrist extensor are affected because only posterior interosseous nerve, that is a deep branch, is only involved. There is no sensory loss here. In this case we have to remember this. There will be finger drop and weak wrist extension. Next is superficial branch at the wrist. It is a pure sensory, so no motor loss will be there. It occurs because of any superficial lacerations or any compression because of handcuffs. Here dorsum of the lateral hand, 3.5 fingers, sparing of the fingertips, all will be affected. There will be numbness and tingling over the dorsum of the hand.